So there's a new study that says the coronavirus pandemic could be having an unexpected impact on another health condition, one that is not physically related to the virus. Jennifer Bellamy joins us now with why researchers believe we're seeing more cases of broken heart syndrome, J. Bell.
Yeah, Aisha, this study found that stress cardiomyopathy, commonly known as broken heart syndrome, has increased since the start of the COVID-19 pandemic, and it's happening with people who aren't infected with the virus.
Heart disease has been a leading cause of death and illness in the United States for years. But a new study published by the American Medical Association Journal has found since the COVID-19 pandemic, there's been a rise in another heart-related condition, broken heart syndrome. Unlike a heart attack, which involves clogged arteries, broken heart syndrome, or stress cardiomyopathy, happens when part of the heart becomes enlarged and can no longer pump blood effectively. It usually follows intense emotional or physical stress. According to the Mayo Clinic, that may mean the death of a loved one, domestic abuse, strong arguments, or divorce. Researchers say their work suggests an indirect psychological, social, and economic pandemic-related stress may be behind the significant increase of the disease. In other words, while it's not a specific health danger of COVID-19 itself, it's a potential hazard of the stressors caused by the pandemic. That's situations like those more Americans are struggling with, like the loss of a job, a health crisis in the family, or financial difficulty. The American Psychological Association's senior director says the findings are concerning, but not surprising, as it's long been known that the experience of stress has an impact on the body. So if you're looking for ways to find some calm, the Mayo Clinic suggests getting in some regular physical activities, practicing relaxation techniques like yoga or meditation, spending time with family and friends, and setting aside times to do things you enjoy.
The Mayo Clinic says broken heart syndrome is usually treatable, with patients recovering within a month or two, but the symptoms like chest pain and shortness of breath mimic those of a heart attack and COVID-19. So if you experience them, doctors say you should go to the hospital.